Okay, our next topic is the safety education and first aid. Overview of this module is accidents and emergencies are inevitable and they occur when we least expect them. In cases like this, do not panic, stay calm, and tell yourself that every emergency can be handled by remembering four things: prevent, prepare, recognize, and act. Quick action can be save or can save a life, no? Because the first minutes after an injury or medical crisis is frequently the most critical. Call for help by knowing the emergency numbers in your community. So the objective of this topic is to provide information on first aid for common accidents, disease, and emergencies. To enumerate common types of disaster. Point out general disaster countermeasures. Discuss disaster management policies. Show signs as leaders of the community of having imbibed the virtues of responsibility, trustworthiness, compassion, perseverance, and commitment. So be aware of the signs of an emergency: difficulty in breathing or shortness of breath, chest or upper abdominal pain or pressure, fainting, sudden dizziness, weakness, changes in vision, confusion or changes in mental status, any sudden or severe pain, uncontrolled bleeding, severe or persistent vomiting or diarrhea, coughing or vomiting blood, and suicidal feeling. Okay. So if you are not sure, then you have to call a doctor. If the situation involves a child, do not hesitate. Children can become sick faster than adults and may not be able to tell what they feel inside. No? Trust your instincts. If you feel there is an emergency, go to the emergency room. If the situation is life threatening or that the person's condition will worsen on the way to the hospital, don't hesitate to call professional help. Huwag matakot. Tumawag kayo ng doktor ng tulong. So, beware of the signs of an emergency. No? So, the treatments for cuts and scrapes. No? Always mentally alert. No? So, bruises. So, this elevates and apply ice for 20 minutes. Don't massage the area. Ha? You have to put on the ice pack. Minor bleeding. First, of course, you wash your hands. Then wash the wound thoroughly for at least 3 minutes with soap and water. Rinse the wound. If the wound is in an area that will get dirty, cover it with antibacterial ointment, gauze, or an adhesive bandage for a few days, but be sure to change the dressing every day. Okay? So heavy bleeding, put continuous direct pressure with your palm on the wound to control bleeding. Okay, use gauze or clean cloth. Wash wound with soap and water. Actually, the regular control of bleeding is about 3 minutes. No? Then call an ambulance or bring the injured to the hospital if the wound is big, deep, or heavily bleeding, or blood spurts from the wound, or he cannot move or feel the body parts below the wounds or numbness, or the bleeding is still heavy after putting pressure for 15 minutes. Bring the injured to the emergency department if 1 to 3 days old show signs of infection. Cuts are on his palm, neck, face, or genitals. Dirt or debris is embedded in the wounds. He developed a fever or swollen glands after getting hurt. Then the cut is made by knife, scissors, or ragged piece of metal. Kasi baka may tetano, no? Or baka meron pang nakatusok na mga debris. Then punctured wounds. Clean the wounds thoroughly for at least 5 minutes. Dry gently and apply an adhesive bandage. Notify a doctor for further treatment advice. So the doctor may want to give preventive treatment such as tetanus, a toxin booster injection. If there might be glass or another foreign body in the wound, bring him to the doctor. Okay, now we have the burns. How to treat burns? Chemical burns caused by acid or chemicals. Remove the clothing contaminated with the substance. Rinse the burned part with clean water for 20 minutes. If chemical gets into the eyes, rinse with water for at least 30 minutes and at the same time. Okay? Call Regional Poison Control Center about the need to go to an emergency room. Do not rub the skin. Do not apply ointment or butter. Call doctor immediately. Electrical burns. A person with an electrical burn should go to the hospital right away because electrical burns often cause serious injury inside the body but may not show on the skin. So, sa loob, nagkakaroon ng problema. Burn from heat. Do not remove the person's clothing. Put the burned area of the body in cool tap water or underwater from a hose, or if you are in outdoors, then continue to cool the burn for at least 20 minutes. Do not apply ointments or butter. Then, lastly, you have to call a doctor if there are 3 or more blisters in the skin or if a blister is bigger than 1 inch. It was electrical burn or if the burn is on the face, neck, head, feet, or genitals. So, an explosion caused by burn. There are areas of white or charred skin. Then, we go to the animal or human bites. So, as we all know, there are animals that carries rabies. No? So, calm the injury and control bleeding with pressure on the wound. Wash with water. Call the doctor immediately or bring him to emergency room. If the area around the bite is swollen and red, he was bitten by animal or at risk for carrying rabies or venom, like dogs, cats, or a monkey, and snakes. No? If the skin is broken by the bite. Next is the first aid for choking. Ito yung bumabara sa lalamunan. Okay? See if the child can dislodge the food or object by coughing. Do not give fluids. It may worsen the problem. No? Baka pumasok ng pumasok yung nakabara sa airway. If the airway is completely blocked and the child does not able to speak or breathe, do the following. For a child younger than age 1, use back blows. Place the baby face down in 60-degree incline over your knees or on your forearm so the gravity will help propel the object out. Or give 4 hard blows with the heel of your hand between the shoulder blades in rapid succession. So if the breathing has not resumed, lay the child in the floor and apply 4 rapid chest compression over the lowest breastbone or the sternum. Use 2 fingers only. This is age 1. For age 1 above, no, uh, grasp the child from behind, just below the lower ribs, but above the navel in a beer huge fashion. No? Make a fish with one hand and fold your other hand over it. Give a sudden upward jerk or at a 45-degree angle to try to squeeze all the air out of the chest and pop the lunch over out of the windpipe. Repeat this upward abdominal thrust 6 to 10 times in rapid succession. If the child is too heavy for you to suspend from your arms, lay him on his back on the floor, but your hands on both sides of the abdomen, just below the ribs, and apply sudden strong bursts of upward pressure para lumabas. No? Then first aid for fall. So falls are the most common form of injury visits to the emergency room for young children. If the child falls, he may have a head injury, fracture, or a blood trauma. You have to call a doctor if the child is unconscious, having trouble breathing or moving, or may have a neck injury. Go to an emergency room if the child is younger than 6 months, cannot move a limb normally, or if a bone looks deformed or crooked. Call the doctor or go to the emergency room if the child is younger than age 1, has a severe headache, or is in a seizure. If he has lost consciousness or is not acting normally, if has broken skin and may need stitches, if is still crying 10 minutes after the fall, and has blurred speech, has blurred or double vision, or is walking crawling unsteadily, no? If he's vomited, if is unusually sleepy and difficult to awaken, and if the has it has blood or watery fluid coming from the nose or ears. Then if also complaints of worsening of head and neck pain. For drowning, the first aid, call the emergency help. The person is unconscious. He has been in shock. He has trouble breathing or cough or wheezes continuously. He was submerged in water for more than a few seconds. No? To rescue the person from the water, try to reach him without getting into the water itself. Look for the spot in the water where you show him last until you reach him. Bring a rope, towel, or another hard object for him to hold until while being brought here. Especially pag nagsiswim, no? Huwag kayong magpapahawak pag nalulunod yung pasyente. Never kayo magpahawak sa kanya. Kayo ang humawak sa kanya. Kasi pag hinawakan kanya, mag-struggle siya, pareho kayong malulunod. Oh, so when a person is out of the water, so see if he is breathing. If not, begin a mouth-to-mouth resuscitation. If there is no pulse and perform CPR, kailangan gawin nyo yan. So you need to know that. No? Remove wet clothing, cover him with dry cloth and blanket. Continue CPR if he is still not breathing and has no pulse. If he is unconscious and not breathing, turn him sidewards to avoid inhaling more water, saliva, or vomit if he throws up. If unconscious but breathing, call for help. Do not leave him. If no help is available, take him to the nearest hospital and carefully immobilize the head between pillows or rolled up articles of clothing. Keep the body lying straight and do not give up. Keep giving CPR until he begins to cough and breathe alone. So these are the activities, no, that we made, no, the lectures, the seminars, no, here in PUP Taguig. the bandaging, how to carry a patient, no? Kasi pag halimbawa binuhat nyo agad ang pasyente, hindi nyo alam na may bali pala siya, baka yung paa ay kamatay niya. So, huwag nyo gagalawin yung pasyente. No? Kausapin nyo na, huwag nyo patutulugin. So, for the activity on this module, so make a proper demonstration on any first remedy using an audiovisual presentation of your own, at least 3 minutes, on how to handle an emergency patient. You can choose CPR, the bandaging technique, the first aid for fracture, first aid for choking, first aid for drowning, the treatment for animal bites, the treatment for burns. Take note, you can ask help for your relatives and friends to assist you, or you can watch it in YouTube. So thank you very much. Have a good day.